It's really great to see all of you here today, and thank you for spending your evenings with us to hear a little bit more about the program. I'm very excited to be able to welcome both Liam and Louise, who represent some faculty as well as students who are involved in the course at the moment, to share some really valuable insights in terms of why you might want to consider the course and why you might want to consider enrolling yourself, as well as a really great opportunity for you to speak with them directly in terms of any questions you have or experiences that you would like to hear about. Just as a few housekeeping rules, throughout today's session, if you do have any questions, you're welcome to put them into the FAQs, where we'll moderate in the background as well as pass to Liam and Louise to answer. And just a note as well that the session is recorded. So if you do need to go back to it after the fact, we'll be making sure to share it on our socials and all the other relevant platforms. But with that being said, I'll pass it to Liam for introductions and to kick us off.
Great. Thank you very much, Ming, and thank you everyone for being here today.
Hello, I'm Louise Kennedy-Young. I am a student in this program. So I've done this program from rural Victoria. We're in Gippslands, and we're doing the grad cert. And yeah, so I'm a team leader of a program where we have therapists in the team, and so some of us are doing the course. So we're nearly finished it now. The end of this semester will be finished. So that's a little bit about me.
Perfect, and thank you again so much for your time and for your contributions to this evening's discussions. I think having insight of students is really so valuable for folks who are also considering enrolling. We've managed to sort the tech issues, so apologies for that inconvenience, folks. I'll pass it on to Liam to introduce themselves.
Excellent. Thank you very much, and thank you for being here, everyone. Thank you, Louise, as well, for coming on and giving your insight and input regarding the course. So my name is Liam Spicer. I'm the course coordinator of the Graduate Certificate in Trauma-Informed Care and a senior lecturer at CanMiller. I'm also a psychologist in practice and an EMDR trainer as well. And that's one of the things in relation to the Graduate Certificate in Trauma-Informed Care. We really make sure that, I guess, a big part of that is not just sort of theoretical or academic knowledge. It is really bringing in real life and real world knowledge of actually working directly with clients from myself, but also other faculty and guests, speakers as well throughout the course as well. So yeah, thank you for being here, and I'll go on to the next slide if that's okay, and move through some of the course content. So I do want to provide an acknowledgement of country that CanMiller is founded on the unceded lands of the Wurundjeri peoples of the Kulin Nation. We pay our respects to their elders past and present and acknowledge their deep enduring connection to land, waters and community. I want to also acknowledge the richness and value of the knowledge and cultural knowledge spanning vast expanses of time, and extend this to any people here as well, Indigenous people or of this continent and all adjacent lands. Thank you. So a little bit of an agenda for today. We're just going to briefly go over a little bit about CanMiller. Some people may know a little bit about CanMiller already, some people may not. Then I'm going to provide a brief overview of this course, a little bit of overview of the different units that we have on offer as a part of the Postgraduate Certificate in Trauma-Informed Care, and importantly, space for Q&A as well. If you want to sort of ask any questions, there'll certainly be enough time for that. And that's really one of the important things. Hopefully you can come away with your questions answered and get a bit more information about the course. So why CanMiller? So CanMiller is a pioneering psychology and counselling institute in Australia since 1961. One of the big things regarding CanMiller, and in particular for this course as well, is that it is very flexible in terms of study options. You learn from experts and practitioners, and that's one of the really beneficial aspects of this course and the other offerings we have at CanMiller, that you are often learning from people that have academic experience in terms of teaching, but also as well research and clinical experience as well. So one of the things I've tried to embed quite a lot into the course content in the Graduate Certificate in Trauma-Informed Care is actually real world case examples, talking about sort of practical considerations as a trauma practitioner, and also as well allowing, I guess, some development of skills in particular ways. Regarding Cairn Miller, we do have sort of a lot of professional development opportunities. It is a not-for-profit, and as I mentioned, that triple helix of training, research, and clinical practice, which I think is really important when we think about certificates and different courses like this. I think having that sort of practical and clinical components really important. Next slide. So a little bit about me. My name's Liam Spicer, as I mentioned. I primarily work in the field of trauma and do a lot of sort of teaching and supervision in that particular space. Also work a lot with neurodivergent individuals and bring quite an integrative approach as a therapist as well in terms of teaching, research and training. As I mentioned, I'm an EMDR trainer, so do a lot of work in that space, but also other approaches as well, schema therapy, somatic approaches. And I think that's one of the things that we do emphasize with the trauma-informed certificate is really building up a wide range of different skills, whatever role that you might work in, clinical or not. In my spare time, I like spending time with family, spending time with my animals, spending time in the garden, and also reading and traveling as well. So overall, the course is a postgraduate program that really provides advanced trauma-informed care knowledge across assessment, interventions, and systemic applications. So whether you're working in a direct clinical role or working in a leadership role, whether you're working in more of a supportive role, the course is quite broad in terms of the knowledge and skills that you get. Next page. So in terms of the study modes and loads, it is an online course structured over 12 weeks. There is weekly drop-in sessions for Q&A and getting support for assignments. So that's a 1 hour drop-in session where you can come along and hop on Zoom with myself or one of the other teaching faculty for one of the other units. And a part of that, you can come along and ask questions about the content from the week, any of the readings. If you have questions about the assignments or anything else, that's certainly the space for that. But it is an optional thing. Obviously, people might be busy or have other conflicting demands with work roles and everything else. So it's certainly not a mandatory thing. And in terms of the online recorded lectures, each week there's a sort of 1.5 to 2 hour lecture, sometimes a little bit longer. And that would be something that you can just go in and engage and watch in your own time, in addition to the pre-selected readings for each week. So it is quite a flexible online program. It can be done part-time, so you can just do like 1 unit a semester if you do have other existing requirements and other jobs, for example. You can do it full-time as well, which is just the 2 units a semester. So overall, the graduate certificate is 4 units that you need to complete. But as I'll chat about in a moment, you do get a little bit of choice about that, and that's going to increase even further for next year's offering. Next slide. So in terms of the course outcomes and structures, students who satisfactorily complete this course will be able to demonstrate skill knowledge in the following areas. So understanding of specialist trauma-informed theories and models. So we really provide a good overview of different models and approaches in terms of looking at trauma, really looking at different sort of neurobiological models and looking at really up-to-date research and more specialist trauma-informed approaches. Really looking at trauma-informed principles in terms of our assessment, but also treatment planning and interventions, integrating theory and practice to develop client-centered trauma-focused interventions. We also really try and emphasize sort of critical and crucial reasoning in the trauma-informed care space, effective and clear communication, and really that self-motivation and self-directed learning principles. So there's a whole range of career opportunities. I think as people are already aware, being trauma informed, having trauma knowledge, gaining skills and expertise in the trauma space really sets you apart in terms of different career opportunities. We increasingly know that in many different sectors out there, whether it's direct counselling roles, whether it's working in case management, social work, NDIS, leadership positions, having knowledge of trauma and how to be trauma informed can be really effective and really useful in terms of supporting the people that you work with. So whether you are a supervisor, whether you're in child protection, domestic violence, whether you work in private practice, or whether you're just wanting to gain a little bit more knowledge as you're still understanding where you want to go with your career, having more knowledge in the trauma-informed space really does help in terms of different career opportunities. So here's a bit of an overview here in terms of the course structure and credit points. So the foundational unit for semester 1, the Foundations in Trauma-Informed Care. We also have trauma-informed assessment, treatment planning, and recovery. So both of those units were offered in semester 1. We then have 3 different units on offer for semester 2. So intergenerational trauma and trauma-focused interventions, that is a unit that everyone would complete as a part of the postgraduate certificate. And then from there, though, for semester 2, you do get a little bit of choice regarding whether you want to do trauma-informed care and family, domestic and sexual violence, or if you are perhaps in a leadership position, more managerial, or you want to learn a bit more about the leadership space and trauma-informed care, you can also choose to do the trauma-informed care and leadership unit as well. And as I mentioned, there'll be even more flexibility regarding some of the unit choices moving forward for next year. Next slide, thank you. So a little bit of an aim for this unit is really to assist students in developing a foundational understanding of trauma-informed care, including its theoretical, empirical, and practical underpinnings. So we talk about a whole range of different theories. We talk about how to apply trauma-informed care with diverse populations in terms of culture and ethnicity. We talk about it in terms of neurodivergence and other adjustments and considerations. So we really provide a broad overview of some of the really key foundational knowledge and up-to-date research in that space for foundations. For the next unit, on the next slide, 402, this is really about assessment, treatment planning, and recovery. So how do we engage in a trauma-informed assessment? How do we consider, I guess, the way that we engage in treatment planning and understand different co-occurring mental health challenges? We talk a little bit about different therapeutic interventions and, importantly, case formulation as well. Next slide. For TIC 403, this is intergenerational trauma and trauma-focused interventions. So we really take a deep dive in this unit in terms of understanding intergenerational trauma. We talk about it quite a lot in relation to Aboriginal and Torres Strait Islander individuals, but also as well, we spend a lot of time talking about different trauma-focused interventions. This includes things like EMDR, imagery scripting, trauma-focused CBT, somatic approaches, but also some other approaches and adaptations for neurodivergence, children and adolescents, and also really emerging areas in the field such as psychedelic-assisted therapy, somatic therapy, and other things like that. So quite an exciting unit. Then for TIC 404, this is really about how we apply trauma-informed care principles when we work in the space of family, domestic and sexual violence in a broad range of different roles. And then moving forward to TIC 405, we talk a little bit about how we sort of work with leadership and understand trauma-informed leadership in different ways. I might throw it over to you, Louise, if that's all right. And yeah, do you have anything to provide there, the students, regarding, I guess, some of your experiences with those units so far? Anything that you wanted to share, or any particular lessons or insights that have come from your time in the course?
Yes. So I really like the fact that it's flexible. I can engage with it when I want to. So each week, a lecture series, a couple of lecture series are put up, and we can take the time whenever we need during the week or the weekend to watch those. And also readings are released every week as well. So and I like the fact that ideally, when we have the check-in, I like to have read the information, have seen the lecture, so I can engage in discussion about it. But sometimes I don't get capacity to do that. So, so the more organised you are, the more you get out of it. So, but sometimes that doesn't work out that way. But it's great to have those check-in sessions so we can engage with usually it's you, Liam, but there's other facilitators as well of the programs, and the other participants, which is really good to share ideas.
Definitely. Yeah, thanks for sharing, Louise. And yeah, it's one of those beneficial aspects as well, because often with online learning, it can be really beneficial, and a real positive is the fact that you can do it in your own time, and when you do have the time to do that, which is really flexible. But one of the things, as you mentioned, that we've tried to build into the drop-in sessions is the opportunity for people, if they still want that sense of connection, that they can come online, they can ask some questions, they can connect with other students as well, which is a nice experience. So yeah, I really like that component. And yeah, as it mentions here on the slide, that there's sort of a weekly lecture for each unit. There's also weekly engagements with reading and other resources. Also the engagements with assignments. And one of the things that we've tried to do, being a very sort of practical focused course, is we've tried to make the assignments quite practical as well. You certainly don't have sort of 3 big essays or anything like that. There's no exams for the course at all. It's more practical focused assessments in terms of maybe creating a bit of a program or a treatment plan, or creating a bit of a poster to talk about trauma-informed care principles. There's a few little quizzes that are inbuilt as well. So really trying to engage in more practical and more sort of tangible focused assessments. And another thing as well, just in relation to how will you learn, for many of the different weeks as a part of the contents, we do a thing called the Ask an Expert series. So rather than necessarily every week, I'm just talking and doing the lecture myself, I'm also catching up with different colleagues and experts from both Australia and internationally on a range of different topics. So for example, on one particular week when we're talking about trauma-focused interventions, I might catch up with someone and do a 45-minute interview on imagery scripting. On another particular week, I've caught up with people and interviewed experts in Australia and internationally on psychedelic assisted therapy for PTSD. So that's one of the things as well we've built into the course, is a range of different interviews that I've conducted with different experts from Australia and abroad on different topics. So you get a different experience and input, and it's also a nice way to learn as well. Rather than just PowerPoints, you are getting that sort of conversational style of learning. Next slide, if that's okay. So also as well, in addition to focusing on the postgraduate certificate, people will also have the opportunity from next year to actually enroll in the postgraduate diploma. So enrolling in the postgraduate diploma, you can be completing all the units from the postgraduate certificate, but there's also going to be some more advanced units as well. So you can complete the postgraduate certificate first and then continue on to the postgraduate diploma. Or you can actually, from next year, enroll in the postgraduate diploma, where you can actually do all the units, 4 units each semester, or you can do it in a more part-time capacity if you like. And these units as well include things like a whole unit on EMDR, where you will actually become trained in the EMDR therapy, which will meet the training requirements from the EMDR Association of Australia. There's also going to be a unit on trauma-focused CBT narrative therapy and imagery scripting. Another one on advanced trauma-informed knowledge, sort of taking up the skills and knowledge level to a higher level. And there's also going to be a unit on trauma-informed research for people keen to get a bit more engaged in that space. Next slide, if that's okay.
So Liam, before we actually move on, there has been a question coming through regarding the unit descriptions that you were talking through. Someone's asked, does TIC 403 involve learning about how to practice EMDR or somatic therapy, or just to learn about the therapies themselves?
Yeah, that's a really great question. So for some particular therapies, there will definitely be a coverage of what the therapy is, and sometimes there is a little bit of a discussion regarding different skills and techniques that you can use. So if it is a more skills-focused therapy like DBT, or if it's a more skills-focused therapy like somatic techniques, then certainly that's covered. But in terms of the actual training in the theoretical approach, such as EMDR, that actually really requires a whole unit. So in terms of TIC 403, we do have a whole week on EMDR. So that's about a 2-hour lecture. We have a whole week on imagery rescripting, for example. But in order to actually learn those therapies, it does take a lot longer than just a few hours. So you'll be introduced to the research behind it, how it works. You'll be showing clinical videos of how some of these therapies work, and there'll also be some Ask an Expert series interviews about these therapies. But in terms of those more intensive trauma-focused therapies like EMDR and imagery scripting, they're going to be focused more in depth for the graduate diploma units that you can also enroll in as well, where you actually meet the training requirements in order to actually use those with clients. So yeah, you do get a bit of a glimpse into some different therapies and approaches, but some of them do require a little bit more than just the 2 or 3 hours we have for the TRC 403 unit. Hopefully that answers your question. Great. Thank you. So as I mentioned, the graduate certificate provides pathways to this advanced qualification. It also gives a lot of specialised skills for diverse roles. Graduates will possess specialised expertise, practical skills, and also cultural awareness and cultural humility. So that's a really big part of the course as well in terms of upskilling, in terms of being more culturally aware. It's really taking that framework of being sort of culturally humble, but also as well, not just regarding culture, we also do spend quite a bit of time talking about other individual differences as well, such as neurodivergence and other components and how that relates to trauma-informed care. Next slide, if it's okay. We have a whole range of different student support options here as a part of Cam Miller Institute. There's often academic support, international student support, learning equity, flexible study modifications for students with accessibility needs. So you can certainly get a lot of support as well to make it flexible with you. And we're really here to make it useful for you. In terms of the entry requirements, so it is a minimum 3-year Australian bachelor degree in a related discipline such as social work, social sciences, psychology, counselling, with at least a 60% average mark. Or it can also be a minimum 3-year bachelor degree in any discipline with at least 60% average and relevant work experience. So if you do put in an application or have any questions, certainly feel free to reach out regarding that. And also as well, you can engage in the course if you have successful completion of a diploma or advanced diploma and at least 1 year's work experience in a relevant field. So certainly reach out if you have any questions regarding your entry requirements. Next slide. So the next steps from here, applications are now open for semester 1 next year, and we'll certainly be really excited to have you as part of the course. If you're interested, you can visit the Cam Miller Study at CMI How to Apply webpage. Applications will be reviewed immediately, so often people will get a sort of answer and response back within sort of 2 to 3 days. And yeah, if there's any questions or anything, then you can certainly reach out to our applications team. applications@canmiller.edu.au. So thank you for your participation. As I mentioned as well, feel free to reach out if you have any direct questions to me regarding what's sort of covered in the course in greater detail or anything like that. Feel free to certainly reach out. There's my email here. And yeah, I might throw it over to you as well, Louis, if there's anything else that you have to share regarding maybe the assignments or perhaps the sort of practical components of things, anything else that you would be willing to share as a part of your experience?
Probably with the assignments, they're a little bit mixed in the assessments. It's not just an essay, like one might be an essay, another might be an infographic or a report, or we have done a joint program where a couple of us have done a presentation, a slideshow on a particular assignment, and then most of the others were, you know, just one person handing an assignment, so that's good too. And when the assignments are due, sometimes it's worked out there was a break at the same time of a break in not having a lecture and readings that week or something like that. So that was helpful too.
For sure, definitely, yeah. And that's one of the things with a course like this, we try to make it achievable. We understand for people, obviously, when engaging in these sort of courses, that they have existing work roles and family commitments and everything else. So we do really try and make it as flexible as possible, and certainly here to support you in terms of, yeah, making it something that's going to be really useful for you. So yeah, I just want to check in at this point if there's any other questions that anyone might have regarding the content or anything else, or any other questions about the course.
So a couple of questions that are coming through, sorry, which I'll be providing some responses to. But while I do that, one question I wanted to put to both Liam and Louise is, what is for each of you, kind of separately, what do you think is either your favorite aspect of the course or what you find makes it most unique?
Great. Yeah, if you want to go firstly, that would be good.
I did like, it's quite a bit of work on top of my full-time role, but it's flexible enough that I can sort of try and fit it in when I can. And probably the fact that I can do it all online, otherwise I wouldn't have been able to, and at my own pace, I wouldn't have been able to do it. I don't think if I had have had set days where I had to do a 3-hour lecture at a particular morning or something like that, I probably wouldn't have been able to do that. So I like the fact that also Liam and the other staff are sort of approachable and you can contact them and get feedback back. And yeah, that really helps to be able to feel like you've got people to go to if you need support.
Great, thank you, Lou. And yeah, I think for me, it's a really it's a really exciting course that we have on offer here. I think it's a really important area, and one of the things I really like, particularly from students when they come back perhaps to a drop-in session and they say that they've been able to incorporate some new knowledge or new skills in the work that they've done, and then they can see benefits in the people that they're supporting. I think that's one of the real benefits of a course like this. It's often for people that either have an interest or already working in this field or wanting to upskill further, and then be able to learn and integrate that learning into your role and see the positive changes that can come from that. I think that's a really important component that I really value. And yeah, I think the other thing as well I really like personally is being able to include those sort of Ask an Expert series interviews with people. It's been something that's brought a lot of different perspective. All the students have been able to really engage and learn from different sort of world-leading experts and people in Australia. And that also gives people a bit of a sense of different people out there in the field and the community beyond just myself and the other staff here at Cairn Miller. And I think that's quite beneficial in its own right as well. So they're probably a few of my favourite things about the course.
Yeah, I like that too, Liam, having other perspectives there from people, the context that you had in the organisation. So that was really good to hear different views.
Brilliant, thanks, folks. And we do have still a couple more minutes. If you have any final questions, feel free to pop them through to the Q&A. But otherwise, one last question that I will pose to both Liam and Louise is, for anyone considering applying, what is the one piece of advice that you might share with them, whether that's advice on how to apply, advice on what to do to prepare for the course? What would you essentially want to have known perhaps yourself before you went into the program?
There you go, Lou.
Read the big information around what's exactly in each course and or the subjects and whether that's really what you're keen on. So that was really pretty thorough, and it showed, some of the readings, some of the the types of things that they'll be presenting, even down to what the assessments are. That's really interesting to see. Am I the person that can do that? Can I fit that in my life? How am I going to do that? And probably just get your tech right at the start and make sure you know how to log into the Cairn Miller and find all the parts of it you want to find and know where to get the readings. And those sort of admin things, techie things, sometimes slowed me down at the start. But once I had that all on board, that was really helpful. Also, I think some of that you can do micro credentials. Is that right with this as well, Liam? Where you can do, if you can, you might, because you do it all in 1 year, or for us, we did it all in 1 year. And so, but if something happens and you can't finish one unit and you've done another unit, that unit is yours, and it's not like, oh, you're halfway through the course, so you don't get any qualification. You can, and Liam, you can speak to how that works, but I thought that was really good for people that can only get a couple of units done, and then maybe they might be able to go back to the other half of the year or units.
Yeah, and that's a really good point, Lou. And that's one of the things that's really quite flexible with the course. Like some people are just doing 1 unit a semester, and then it's going to take, I guess, a little bit longer, but they're in no rush because they're already doing other things. And as you mentioned, there's some units which we sort of offer as micro credentials. So, for example, the Family Sexual Domestic Violence unit is sort of a unit as a part of the postgraduate certificate, but it's also like its own little course in and of itself as a micro credential in terms of meeting particular requirements as a family sexual domestic violence practitioner. And certainly for next year as well, that's going to be the same with some of the other units that we have on offer. So if you do only want to jump in and do 1 unit, you'll be able to, for example, jump in and just do maybe 1 unit on EMDR rather than necessarily having to do the whole postgraduate certificate. But certainly as well, there's a lot of flexibility and it gives you quite a broad range of different skills. In terms of the thing that I would recommend, yeah, just feel free to reach out if there's any questions or you want to understand a little bit more about what's involved in terms of the units. We do have like a week by week summary and things like that of different units and what's actually covered. So certainly happy to go over that with anyone. Have a phone call with anyone if they have any further questions. Really happy to support you in any way in terms of understanding the next steps.
Brilliant. Well, thanks so much, folks. I think we've managed to wrap up all the questions that have come through. So I did just want to once again thank both Liam and Louise for their time, their insight, and their advice. Like I said at the beginning, it's always so valuable to hear from folks directly. And as Liam's mentioned, definitely reach out to either himself or to our applications team if you do still have any questions about what your next steps might be. But otherwise, like I said, again, thanks once again for all of you who have also attended and expressed interest. We really hope to see your applications come through. And if you do have any questions after the fact, just make sure to reach out. But for now, I'll wrap up and end today's session and hope to hear from you all again soon. Have a great evening, folks, and thanks again. Bye.